Sinus health is an often overlooked topic until we're suddenly feeling quite miserable with sinusitis. Today, we will take a closer look at what sinuses do, why they can sometimes cause us trouble, and some practical tips for anyone dealing with sinus discomfort. There are a few sinuses around the nose. They are called paranasal sinuses. Think of a sinus as a balloon inside a bottle. The bottle is the bony air cell within the facial bones. The balloon forms the lining, or the skin of the sinus, which is called the mucosa. The mucosa is made up of several different cells with specific functions. The goblet cells, which produce a slimy substance called mucus, or snot as we all know it. The ciliary cells have hairs on their surface called cilia. These hairs make wave-like motions which help to carry the mucus out of the sinuses into the nose. The basal cells give the mucosa support. Sinuses play a role in giving your voice resonance and making your skull lighter by replacing bone with air. Without them, you probably wouldn't be able to hold up your head. The mucus helps to moisturize the air we breathe. Furthermore, due to its sticky nature, it traps dust particles, irritants, and microorganisms, which helps to purify the air. In theory, children under 6 can't have sinus infections because they don't have fully developed sinuses. The scientific name for sinusitis is Rhinosinusitis. In Latin, this means inflammation of the sinuses and nasal lining. Inflammation leads to swelling of the sinus lining and increased production of thick mucus. The ciliary movements become impaired and sluggish. All these issues combine to block mucus drainage, resulting in mucus buildup and pressure within the sinuses. Job done. Back to you, Dr. Sam.
Thank you, Professor Amen, for a fantastic lecture. Now let's talk about the clinical aspects of sinusitis. Here is Anita, one of our patients, to talk about her symptoms.
Doctor, my nose is blocked and my face hurts, especially on the left side. My head and ears are killing me. I can't taste or smell anything. It's terrible, doctor.
Sinusitis is classified into acute and chronic. 12 weeks is the magic number. Sinusitis lasting less than 12 weeks is acute, and more than 12 weeks is chronic. Acute sinusitis is most commonly caused by a viral upper respiratory tract infection. Suspect bacterial infection if symptoms worsen or last more than 7 days, and is associated with high fever of 38 degrees centigrade or more. Allergens can also be a culprit. Chronic sinusitis is associated with allergy, smoking, and asthma. Actually, the diagnosis does not require any tests. The presence of key symptoms, together with tenderness over the paranasal sinuses, calls for a clinical diagnosis of sinusitis. There could be other causes that may confuse our diagnosis. These are called differential diagnoses and may include upper respiratory tract infections, rhinitis, foreign bodies, tumors, structural deformities, migraines, jaw problems, nerve pain, and dental infections.
Many things you can do to treat sinusitis at home. Drinking lots of fluid, using a humidifier, taking paracetamol, using saline and steroid nasal sprays, and nasal decongestants will help. Steam is no longer recommended due to lack of evidence of benefit and risk of burns. Please get in touch with your doctor if you experience any of the following symptoms. Antibiotics are often not needed for acute sinusitis as it is usually caused by viruses. Many people recover without antibiotics. Even bacterial infection is typically self-limiting, and antibiotics usually don't shorten the illness. They can potentially cause bad side effects. However, antibiotics may be indicated if symptoms are worsening or persistent after 7 days. As you know, prevention is the best cure. Some sensible precautions include staying hydrated, using a humidifier, avoiding triggers and allergens, and washing hands. Wearing a mask in public places may be something to consider. The most important precaution, in my opinion, is stopping smoking.
Thank you, Lily, for educating us from a pharmacist's perspective. Now let's talk about when a referral to ENT is required. I will refer you as an emergency if you are severely unwell, have signs of sepsis, or there are features suggestive of spread of infection to the eye or brain, I will be inclined to refer you to an ENT specialist if features are suggestive of a neoplasm, immunological issues, or allergies. No improvement in symptoms after 10 days. Recurrent bouts of sinusitis affecting quality of life, and if there is diagnostic doubt. With that, we conclude this edition of Dr. Sam's Surgery. I hope you found this video informative and enjoyable. I would like to thank our wonderful team of guest speakers and the amazing people who formulated the NICE CKS guidelines, which is our main reference for this video.